All of these services have robust governance and education, as we've heard about earlier in some talks. And the teams, who are they? Typically, it is a doctor paramedic or a doctor flight nurse team. There is a significant number of flight nurse only for some less critical transfers. And in New South Wales, that accounts for just under half of some of the inter-hospital transfers that we do. But for any critical patients, all of these services will typically have a 2-person team. In 2 of the states, they do run some dual paramedic responses. And in 1 of those states, they're introducing doctors to their service this year. A little bit more about those people. Our nurses, they are critically care trained, typically emergency and ICU, and depending on the state they work in, they may also be required to have midwifery training. They are not only involved in going out into the actual missions and looking after patients, they're involved on the phone with triage and a lot of telehealth. Our paramedics receive critical care training from the organisations they work in. That's above the EMS services that they've worked for, and depending on the state they work in, might be required to have search and rescue training as well. Typically involved in the cases, but also in triage and tasking of the assets. Our doctors, apologies for that terminology, so we have a lot of training doctors that come through, but these are doctors that pretty much are at the end of their specialty training. So senior registrars, I think the equivalent is senior residents here. Those are our temporary members of staff in some services. So they'll come to us typically for a year, undergo rigorous training programs, have consultant oversight at the whole time, but come for a year and then go back into their training programs or wherever they were going back to. Our specialists or consultants are our permanent members of staff. Typically, the specialties you'll find is emergency, anesthesiology, and intensive care. All our specialists also work in hospital, so they work between both pre-hospital and in-hospital for maintenance of skills. And our specialists also, as well as being involved in the flights, are significantly involved in triage and telehealth around the States.